Welcome. Bonjour. I think we're going to get started. It looks like most people have signed on already. So thank you very much for joining us today. It's our pleasure to welcome you to the second Graham Beck Foundation Policymakers webinar of this year. This time we're focusing on integrated youth services, lessons learned, and we're really pleased that all of you could join us today. Let me begin by introducing myself. I'm Alana Ledman, and I'm the Vice President of Youth Mental Health at the Graham Beck Foundation. For those of you who may not know, the Graham Beck Foundation, or GBF, is a private family foundation based in Montreal. It was started 30 years ago by the Beck family. We work in Canada and internationally to catalyze the transformation of mental health care. As many of you know, much of our focus in Canada for the last 7 years has been on youth mental health and specifically on transforming and improving access to mental health services for young people aged 12 to 25. Now we're going to hear from three great speakers. I'm really excited, and as you know, the movement of integrated youth services really taking off across the country, and so we saw this as a wonderful opportunity to share some lessons learned from the various initiatives that are working across Canada. So first you'll hear from Dr. Vidya Iyer, who's the Scientific Clinical Director of Access Open Minds and soon to be the Principal Investigator for Access Open Minds. She comes to us from McGill and is based in Montreal. And for those of you who don't know, Access Open Minds is a pan-Canadian research network that has really looked at how to transform youth mental health services in different contexts across Canada for the last 5 years. Next, you'll hear from two provincial initiatives focused on integrated youth services. Dr. Joanna Henderson will speak to us about lessons learned in Ontario, and Joanna's calling in today from Toronto, where she is a senior scientist at the Centre of Addictions and Mental Health, as well as the Executive Director of Youth Wellness Hubs Ontario. And lastly, you'll hear from Dr. Steve Mathias about lessons learned implementing and scaling Foundry across British Columbia, and Steve is calling in today from Vancouver. So maybe just a few reminders before we get started. You're going to hear from the three speakers. They'll each have 15 minutes to speak, and I'm going to be a tough moderator, and if they pass the 15 minutes, I'm going to have to intervene. So I'm warning you all now. The other thing I wanted to remind everyone is that we are recording this session. So we do hope to send the recording out to you so you can share with colleagues following the session. We've left 30 minutes at the end for Q&A, and we really encourage you to write in your questions. We're also going to create an opportunity for you to share your questions. So if you'd rather ask your questions verbally, by video, or by telephone and not write them in, you can just let us know that you'd like to speak. We also recognize that Vidya, Joanna, and Steve are three people with knowledge around integrated youth services, but there's lots of knowledge across the country. And many of you on the line, I know, have lots of knowledge and lots of experience, including some of you working in government to advance this work. So we really encourage you during the Q&A and discussion at the end of the session to let me know that you want to share something or some of your lessons learned, and we can create the space to do that. So without further ado, I'm going to turn it over to Vidya, who can speak to some early lessons learned from Access Open Minds.
Sure. Thank you, Alana, for this lovely and warm introduction. It's really nice to connect with you all during these challenging times, and it's indeed my pleasure to be here today and have this opportunity to briefly present some insights from our experience over the last 6 years now, working on transforming youth mental health across various sites in Canada through the Pan-Canadian Access Open Minds network. I thought that it would be helpful to maybe briefly start by talking about youth mental health trends both globally and Canada, and it's really hard to capture that briefly, and it may not even be needed for this audience, but I find it always helpful to start there. I think we all know that the period of transition from childhood to puberty to adulthood is a crucial developmental phase. We also know that over 75% of mental health problems start before the age of 25. And what's kind of most important for us gathered here is that while this is the period of peak need for care, it's also the worst time for access. And while we are trying to change it, we know that the overall picture is really one of unmet needs, waiting lists, with most young people not being able to access high quality care when they need them and on their terms. And this has huge implications in terms of loss of lives, loss of futures, loss of what's increasingly being called mental wealth. We know that death by suicide is the second biggest killer among young people in Canada. And we also know that some of these problems are particularly accentuated in certain contexts and among some populations, and in Canada, certainly among Indigenous contexts. We also know that there's trends both in Canada and in many countries that among young people, mental health may actually be getting worse, and we can speak about that during the discussion. And there are many reasons for this changing landscape of mental health, including in Canada, the increasing utilization of emergency rooms, at least in some provinces. There are many mega trends that seem to be implicated in this, like whether it's eco-anxiety or worry about the future. And with COVID-19 and the economic recession, this is only projected to get worse. What's also sort of really important, given where we are today, is to acknowledge that there's plenty of evidence from across the world and in Canada that mental illnesses really contribute to a significant proportion of the losses, the economic losses, about 35% globally, and yet funding-wise, it's consistently been underfunded. So if this is the problem that we're trying to solve, what is the solution? I think that the solution, of course, is multi-pronged, and there are many aspects to it, including prevention. But part of the solution that we're here today to focus on is really focusing on building and delivering evidence-informed, youth-friendly mental health services centered around young people's needs that is scalable nationally. What's also really important is that this be integrated with high-quality data systems, and that we conduct integrated research that's guided by young people, so that evidence informs policy and evidence informs service design, and that we also are able to continuously sort of understand changing trends, both with respect to service impacts and outcomes, but also young people's needs. And in addition to having this sort of a high quality data system, implementation, support, and integrated research, it's the ability to really share this collectively in real time so that we can benefit from this knowledge. I'm going to talk, as Ilana mentioned, a little bit more about the Access Open Minds project in these next few minutes. And the way I see it is that Access Open Minds is a big, bold, brave proof of concept of this solution. And you're going to hear about other efforts, including the Youth Wellness Hubs Ontario and Foundry soon. And hopefully in the discussion, we can bring it all together in terms of understanding the solution and where we are in Canada. So why do I call it a big, bold, brave solution? In many ways, the way it started and the way it's kind of been implemented and who came to the table to be part of the Access Open Minds network, the first, in a very big sort of first way of diversity and breaking down silos, and in a big, bold way, this came through a partnership between the Graham Beck Foundation and the Canadian Institutes of Health Research. So in terms of partnerships, it was new. In terms of making sure that there were sites and services across Canada that were participating across provinces, Indigenous and non-Indigenous, that this was really about integrating services and research and bringing together multiple stakeholders, young people, families, community organizations, services, clinicians, researchers, and policymakers. So in many ways, the main sort of lesson has been that, on the one hand, this has been a big, bold idea, that there might be benefits to these big, bold ideas, and that we're better together in many ways with diversity and breaking down silos. So this here is just, I'm not going to go through it in detail, but I did want to point out that we have sites across Canada, across 6 provinces and a territory, urban, rural, semi-urban, Indigenous, a site that serves youth at risk of homelessness, a site in a post-secondary institution. And these sites clearly are reflective. I mean, they're not inclusive but completely, but they're definitely reflective of Canada's geographic and cultural diversity. And they represent a multitude of different ways of service delivery organizations. So we have community organizations, primary care, health authority organizations, and Indigenous-led organizations. So working with these very different contexts, I guess one of the key lessons learned has been that it is possible to transform services in these very diverse contexts if we work with core principles being guided by evidence, core principles being also guided by young people's voices, and that it is also valuable to work in diverse contexts, being very sensitive to context-sensitive implementation so that communities really have a sense of this being locally owned and valued by the community in which these sites are situated. I'm going to very briefly present some very preliminary findings. We're still in the process of both collecting data and analyzing data. And the goal here is not to do a full data presentation or findings presentation, but I did want to highlight some sort of important things with respect to who comes when you try to design services in a different way. I think one of our key findings has been that youth at risk of marginalization, whether by racialization or by sexual orientation or poverty, connected with Access Open Mind sites in significant numbers. So we have about 35% of young people identifying as LGBTQ+, about 38% identifying as visible minority. We have about 39%, and this is really important, 39% reporting difficulty meeting basic expenses. We also know, and I don't have it here, but we also know that for significant numbers of youth, both in urban and rural contexts, but particularly in Indigenous contexts, Access Open Minds was really their first experience of mental health help seeking, which is important rather than an emergency room or a setting that wasn't youth friendly. What you have here at the bottom is, again, I won't go through each of these in detail, and I'm happy to provide additional details or clarify things when we speak later. But the main thing that I wanted to highlight was that across Access Open Mind sites, we're really supporting youth coming from a wide spectrum of mental health needs, with significant numbers actually also presenting with complex mental health needs. So what you see at the bottom here is youth rating their own mental health, and we have about 66% of young people rating their mental health as poor or fair. We have about 30% of young people who in the last 3 months before coming in for services had suicidal thoughts. We have young people across all spectrums of psychological distress, but a significant number, so around 75%, endorsing moderate to high levels of psychological distress. I think I wanted to sort of take some time to discuss what does this mean in terms of some opportunities that we have. I think the first sort of opportunity, I've put it here, I think we made in Canada some various sort of multiple investments in mental health and youth mental health, and this is like fantastic. We also know that that means we are prioritizing more and more mental health young people, which is clearly in importance. There have been many recent investments. We also know that these investments have actually, if you do these investments and you break down these barriers or silos, that you actually have some amazing potential in terms of, more young people coming in terms of serving culturally diverse LGBTQ+ and other youth who may have been traditionally underserved, in terms of serving youth with high mental health needs, and also in terms of allowing services and communities to get really creative and truly transform and innovatively improve access to high quality services. We've also made some important efforts in this last little while in terms of creating high quality data systems that allow us to continuously understand what is happening with services, and also not just collecting data, but allowing this data to inform both the care of individual young people, but also service design in real time. And I know that some of you attended the policymakers workshop that took place earlier this year, and you heard about the national sort of system around both psychotherapy and high quality data in the UK and the benefits of it. And certainly the emerging trends from our own experience has been that this is an important investment in terms of it can be valuable. It can also really bring together people to collectively learn and use these learnings to improve services. The other thing that I wanted to mention was that in this, Canada is certainly playing a key role in a global landscape. There are many, many players, but I think in the last few years, Canada has been playing an important role in this global effort to change the cultures of care, for mental health care for young people, and also to really broaden the scope and value of research and data systems in youth mental health, and how these can really be integrated to improve outcomes and service quality for young people and their families and carers. We also have some evidence internationally, but certainly from our own experience, that investments in youth mental health can be cost effective. So early economic, and again, this is early economic evaluation results from an Access Open Minds site, indicate that the model could save up to $4,500 per young person per year and provide a return on investment of approximately $10 for every dollar invested. And what I'd like to highlight here is that when we looked at what is contributing to these cost savings, it's really about young people using emergency services, specialist visits, a lot less than they did in the past. So this is indicative of the fact that the site was doing a very good job of also serving young people with complex needs. And in sort of thinking through opportunities and in thinking through this next phase of youth mental health in Canada, I think it's really important, and this has been an important lesson through the Access experience, that we be guided not only by economics and evidence, which are certainly very, very important, but also really by values, rights-based perspectives, and the voices of young people and the voices of communities and important stakeholders. So we're actually, I'm sort of, before I end, I did want to make this all important point that we have been making investments, and I think there is a lot of value in thinking about sustaining and scaling up some of these innovations so that we can truly benefit. And these might be particularly important in contexts like Indigenous communities, where sometimes funding cycles can be project-based, causing a lot of anxiety about the future. So this is, again, something we can talk about in greater detail. I wanted to end by talking to sort of presenting this declaration. It's a much longer document, and I'd really invite you, because you're all interested in youth well-being and youth services, to look at the declaration by the International Association for Youth Mental Health. And I'd like to end with that because I think it provides a really nice vision. And I don't know if we are there in 2020, but we certainly can hope to get closer and closer to this vision the next time we meet. So in 2020, young people in all communities will have access to the knowledge, skills, and services necessary to respond to and support them in periods of mental ill health. You can really find a lot more of what I presented and a lot more details also about our service transformation and our research project and the communities and the impacts it has had on the communities on our website. Thank you for this opportunity, and thank you for listening.
Thank you very much, Vidya, and thank you for making my life so easy and ending at exactly 15 minutes. I also just wanted to say I'm sure that people will really appreciate, and I recognize it's early economic results, but I'm sure lots of government folks are sitting around and saying, oh, how can I use that in the briefing notes I'm sharing up? So we will make this recording available, and I also know that you feel that it's important to recognize that it really is early results. So in time, more results will be shared and more information will be shared, but really appreciate you taking the time today to share those early results with us. So
thank you, Alana.
We'll save the questions for later. And now I'm going to turn it over to Dr. Joanna Henderson, who, as I mentioned earlier, is the Executive Director of Youth Wellness Hubs Ontario, as well as a Senior Scientist at CAMH in Toronto. So thanks for being with us, Joanna.
Hi, everyone, and bonjour. Ani, hello. I'm very pleased to be here today. I'm just going to start up my presentation, and it's really terrific to be here with my colleagues as well. Vidya and Steve and I and our various teams have been working together over the last number of years to really ensure that our work is learning from one another, that we're sharing our experiences. And so it'll be really interesting to engage in discussion later and see how we can come together to answer and address some of your most important questions and points. In the meantime, I'm going to tell you a little bit about Youth Wellness Hubs Ontario and the lessons learned for us. I'm just going to figure out how I'm going to, there we go. We're a service platform. We consider ourselves a service platform, and I can say more about that as we go. But one of the really important things about these innovations that we're using as part of system transformation is the capacity to not just think about today, but also to think about the future and how, as we learn more about what's effective, we're creating platforms and systems within which we can readily deliver new interventions, the best available evidence, the best available treatments. So we really think of ourselves as a service platform designed to improve youth service experiences and outcomes through increasing access, embedding measurement, and tailoring the services we offer that are integrated across multiple sectors to deliver high quality services. So what do those services include? And as Vidya is saying, we really come from the perspective of having values-based service design. Services have been co-designed with young people as well as family members, and I'll talk more about that and some of the lessons learned. Our services are intended to be youth-specific, so many of you will know that child services and adult services are ineffective and insufficient for meeting the needs of youth. And so these are really youth-specific services that are evidence-based or evidence-informed and youth-friendly. For the one-stop shop model of service, that is Youth Wellness Hubs Ontario, it includes mental health and substance use services, primary care and other health services, education, employment, vocation kinds of services, housing and other community and supports. And importantly, I think one of the things that we have done to sort of really think broadly about the model and really think about what young people need, and through our co-design process really came to understand the critical value of kind of what I'm calling inclusivity focused services and activities. These are a broad range of services that serve to do some of the things Vidya pointed to. We're not just talking about mental illness. We're in fact thinking about how do we change the trajectories of young people who may be experiencing mental ill health early, or who are in a position to perhaps even have the onset of mental ill health prevented. So we really are thinking in that expansive notion where we're thinking about how to deliver a wide range of services that bring young people into centers, creating opportunities for important conversations. We also know that engagement, despite the existence of many effective treatments and interventions, that engagement has been a critical challenge in our mental health system because our systems have not been designed to engage young people. And so part of Youth Wellness Hubs Ontario is really thinking intentionally about what needs to be embedded in the service constellation to more effectively engage those young people so we can have the outcomes that we would like to have. So we take a systems approach, and what we mean by that is we integrate and leverage existing services across sectors in order to provide effective service delivery. And of course, in addition to that, we have new investments that help us go further. Our sites are spread across Ontario and include rural contexts, large urban contexts, and smaller urban contexts as well. So I'm going to walk you through 5 lessons that we've have learned in Youth Wellness Hubs Ontario. There are many, many, many lessons we've learned through Youth Wellness Hubs Ontario, but I'm going to talk about 5. I'm going to try and give you some specific examples as we go. And some of these points I think you'll see are the common value-based underpinning that cut across many of the initiatives in Canada, and particularly those that are on this webinar today. So first, I want to talk about the value of working in partnership with youth and families. And some of you definitely will have heard me talk about this before. It's an area of particular passion for me. But what I want to draw your attention to in this case is Youth Wellness Hubs Ontario capacity to pivot and respond to youth needs in the context of the pandemic. Because we work so closely with youth and families, we were really in, we faced a really important decision moment as the pandemic and our public health responses arose, and we needed to shift our service delivery. One of the things I observed in a variety of different contexts was this sort of retreat into our old ways of working, and around me, people were retreating into, let's get the leaders together, let's get the experts together, because these are important decisions that need to be made. And so we're going to retreat to this position of we just have the experts at the table. And what we did at Youth Wellness Hubs Ontario was instead say, this is absolutely the critical time that we need to have youth at the table. This is going to disproportionately affect young people because all of the things that they are supposed to be doing in this developmental stage, peer relationships, romantic relationships, achieving autonomy, living on your own, working, education, all of these things are going to be directly impacted by both the pandemic and our public health response. And so let's ensure that young people are at the decision-making tables with us so that when we're thinking about how to respond, we're integrating in the moment their ideas and their strategies. And I can tell you that while while a lot of the work we did was to think about how do we take the services we deliver in person and deliver them virtually, a really important piece of work that we did was how do we deliver new services, new kinds of services in new ways to address young people's needs and to bring them in. And those kinds of services that were developed, whether they were, instances of Instagram Live, activities over Instagram Live, or a variety of other things, really helped young people to connect in to the work that we were doing over the course of the pandemic. So just critically important to think of youth and family engagement, not just in sort of some of the things I've talked about before, like model design and implementation and site selection, but in fact, even in those moments where we might be tempted to retreat to an old way of working, we need to stay focused on youth engagement and family engagement. I want to talk also about the lessons we've learned about the value of working with existing resources and across sectors. And I think I also want to say something about across initiatives as well. But first, I think what we've seen in terms of a real focus on working together as in each community and network working together, and then across the province, a network of networks working together, is that we really have that opportunity to pool expertise, to pool resources, to respond to different kinds of challenges that can arise. And what we've seen is that by using both existing resources and a new investment of resources, we are able to ensure that young people can move fluidly among the services offered in the hub, but then where necessary, also easily move to other more intensive services if that's required, or other kinds of services in the community. Our work across sectors has really positioned us to be able to innovate, not just in a very narrow space around mental health, for example, but in fact to think about the intersectionality of mental health and, say, for example, employment and substance use, education, and really to think about how all in a young person's life and in a young person's experience, they're not divided up into these separate pieces. They in fact experience all of those things through the lens of their health and mental health. And so as an example, working together, Foundry, Youth Wellness Hubs Ontario, and Access Open Minds were able to secure funding through a federal initiative and now we're implementing employment supports, a very specific evidence-based kind of employment supports across all three initiatives, and to look at how we can implement that, how we can adapt to our different contexts. But at the same time, we're because we work across sectors and because we're thinking in this integrated way, and we're doing the combination of existing resources together with new investment, we're really able to leverage, and because we're working across our initiatives in a collaborative way, we're really able to move the needle, I think, for young people in Canada. Another lesson I'd like to focus on is really the importance of thinking about core components and adaptation. Probably don't need to say a whole lot about that, given the context of the pandemic has required all of us to adapt in really significant ways to a totally different way of working. So that's kind of one level. We have that massive adaptation that we were required to do, and required to pivot, quickly and effectively. And I think that's really important. But I think even on the ground, and some of you will have probably heard me talk about this before, the notion that we have to understand what are the core components that are essential to translate into the outcomes we want for young people. And we also need to understand where are the places, what are the pieces in the model that we can adapt to local context that might actually even improve our outcomes because it makes it more appropriate for a local context, or it might make it more feasible to be implemented. So if we think, for example, of rural contexts, where we might be thinking about like a physical one-stop shop, sort of the physical space being an important piece of the work that we're doing, creating that space in a community where young people can come together. When we think about large rural geographic areas or regions, that sort of single physical space may not meet the needs, of course. So how do you take the core components that are embedded in the thinking around a one-stop shop and then create that to be available across a rural context? So that idea that we can work in really understanding in a systematic way what are the core components and how do we adapt. And not only do we do that alone within Youth Wellness Hubs Ontario, but in fact, again, we're doing that across the country so that, we can learn from each other. Canada, of course, has rurality is a prominent feature across the country. I'd like to talk a little bit about lessons we've learned about the value of inclusivity-focused services. So this is, I mentioned this before, these are services that are intended to engage young people in the service delivery model, in youth wellness hubs, to respond to what young people would like to see in service delivery, and ensure that we are creating inclusive spaces where young people feel comfortable, where they feel like as many of their needs as possible can be met. We are just at the beginning of systematically evaluating the extent to which offering these kinds of services translates into those opportunities for connection to mental health services where appropriate. But certainly anecdotally, it seems that these services are really drawing young people into the centers, and especially for our most vulnerable young people, creating opportunities for them to visit a hub, for example, and have repeated interactions to develop some trust, and then to have that then translate into mental health conversations. So this is going to be one to watch over time, but it's something I'm very excited about. You know, Youth Wellness Hubs Ontario really comes from an equity lens. It's embedded in all of the work we do, and we see that this is one place where we're really able to bring that to life. And then lastly, I just want to say a couple of things about branding. And I think, you know, the pandemic has shown us both, I think, federally and provincially, and not just in Ontario, but in a variety of provinces, the value of having messages that are really easy to convey, and having services that have a prominent, well-known brand that you can convey in one sentence, two sentences. We see through the pandemic that we need to be able to point people to services easily and efficiently. And we need to have confidence about what's behind the brand. And so I think, you know, one of the things that we need to continue to consider how we can achieve system-wide sort of recognition of all of the services that are available to young people, is to really give some thoughtful consideration to branding, how to go about it, how to ensure that youth are involved in a branding process, and then how do we make sure that that the information is readily available to decision makers. Here are the ways that you can contact us or find out more about Youth Wellness Hubs Ontario, and I will hand it back to Alana.
Thank you very much, Dr. Henderson. Always great to hear from you, and I think, you know, just really hearing about, reminding us of the importance of engaging youth, even in times of crisis and adaptability like the pandemic. And I think, you know, also highlighting the importance of brand. And I think our next speaker is going to be able to speak to the power of brand for sure. And if it's not in his presentation, I'm sure he can speak to it in the discussion portion. So thank you very much, Joanna. We'll circle back with you for the Q&A. So now I'm pleased to introduce Dr. Steve Mathias, who is the Executive Director and founder of Foundry, as well as a trained child and adolescent psychiatrist.
There. Hi, everyone. Just trying to work through a couple little things here, so we'll just give me a quick second, and then we'll, yeah, here we go. Okay. And Alana, is everyone able to see that?
Yeah, that's great.
Okay, fantastic. Lovely to see everyone. It was really exciting that I had an excuse to get dressed up today. At least half of me is dressed up, so really, really pleased to be presenting here with my national colleagues. Some of you have been probably sitting in on these presentations for the last 3 years, 4 years, so it's probably exciting to just see how much integrated youth services have advanced across the country. I'm hoping to touch on some things that there will be overlap with what Dr. Henderson has just spoken about, but hopefully we can also lend a little bit of insight into some of the ingredients in what is called the Foundry special sauce here in British Columbia. So, sorry, I'm just gonna. So before I get too far, I just want to acknowledge with gratitude that place of work is on the ancestral territory of the unceded, the ancestral and unceded territories of the Musqueam and Squamish Tsleil-Waututh nations. And so we're pretty grateful to be here today. So our vision for Foundry was really to transform access to health and social services for youth and families, and that transformation it was meant to be a bold statement for us. We follow up that statement now by saying we aim to make British Columbia the best place in the world for young people to grow up. I say that during my presentations because I have 3 children at home, all either Foundry aged or younger. And I really am committed to trying to make this the place that's going to be the most responsive to their health and social needs. And in a really simple way, what we're trying to do is support youth in living a good life. How we do that is Foundry offers young people ages 12 to 24 health and wellness resources, services, and support. And the focus on the word wellness and health are really critical to what we do, because our young people, again and again and again, when they've been surveyed, have said that they don't want what they're struggling with to be stigmatized. And when we use an illness model with young people, they really respond negatively to that. And so what we understand is that young people will come through our doors in various stages, and we want to bring them in, entice them to come in with a strength-based model. And so our centers are co-designed with young people. We'll be getting to how many centers we have in a second. But as you can see there, this is the entrance to the Foundry Ridge Meadows Center that opened a week before the COVID lockdown happened in British Columbia, so to speak. We pivoted to include virtual care, which was launched in April, and we'll talk about that in a little bit as well. And this is an app that we will be rolling out in the next month or so. That's been under development for 4 years. And we also have our website that has a Pathfinder function that allows young people to get support when they need it by going online. Our centers cover the southern half of the province. That's also where most of the population resides. We currently have 11 operating centers. The first opened in 2015, the second in 2016, and we've been opening centers every year since. We recently had a mandate through the Pathway to Hope strategic plan that was released by the Ministry of Mental Health and Addictions last June of 2019 to identify 8 future communities. And so the work is underway with those communities now. We have small communities, as small as 1,400, planning to open a center. The largest community, or one of the largest communities in British Columbia, Surrey, is at the other end of the spectrum and has also been announced. 2 of our lead agencies, these are for the most part run by nonprofit organizations. 2 of our lead agencies are Indigenous organizations, which is really exciting. The Kariusakani and the Tanaha nations in Burns Lake and in Cranbrook. Our model really started with this notion of core services, this idea that we could provide predictable services. There was a real need in this province to be able to say to a young person where they could go and get help. But where we have really pivoted to over time as our brand has grown, and we've seen young people really take on a role of advocate in the community, is that we really see ourselves as offering life care now. This is a term that we're growing to like, moving away from the terminology of healthcare due to, unfortunately, some negative experiences and negative connotations by many of our young people with healthcare. And this is why we have our core services, and our menu continues to grow, particularly in the social service realm, where we have more and more services in our centers. We have the benefit of collecting all our data on one platform, similar to the YHoo and Access Open Mind models. So we know that we've had at least 13,500 young people use our services in the past year and a bit. And what's really exciting for us is that while we knew we would be providing mental health and substance use services, we also recognize that almost 50% of young people are coming in for physical health needs, either physical health or sexual health. And we've also begun providing a solution-focused brief therapy model that we've been working with folks out of Ontario to develop. And this has led to many young people getting this service. It's our most popular service in terms of per day access. And this is a growing need, or a growing need has been identified for same day access to walk-in counseling. The age at registration, just to show you again the demographic that we're seeing, our brand really lands nicely in the 16 to 21 age range. And what we're trying to do is really expand the left shoulder, trying to develop a communication strategy for the 12 to 15s. And a lesson learned for us is that group really requires its own specific strategy, because their service utilization pattern is different than the young people who are older. And so these young people tend to come in for one session, tend to come in for walk-in counseling or psychological distress, and don't tend to use our physical health resources, and certainly not our social services. And so we need to cater to them in a different way and really think about our communication strategy there. So one of the lessons learned for us really is that true integration of services requires a focus on the word integration. So we often see this term integrated use services, but there isn't a lot of science around what integration actually means. And so this is an area that we've been trying to understand over time. We're trying to make this a reproducible and scalable model. I think we've been relatively successful with this, but we can do more. And part of that is really understanding what governance structures need to be in place to make this approach work. This idea that any community should be able to open a Foundry Center is one that our communities have embraced, the province has embraced. In our last expression of interest, we had 40 communities apply to open up a Foundry Center. And so when we look at this, our steps to transformation include the early need to form partnerships, then to really build out relationships. In some communities, the relationships have been fractured by years and years of siloing. Improve collaboration, and then start to have real conversations around integration. And that leads us then to the ability to implement a step care model, which is I think a breakthrough for us, and has been something that we've been able to do in most of our centers by the second year of opening. We've been working off of a model called the full-up typology of integration. And so when we talk about integration, we're really thinking about them in these different domains, these 6 domains, and we're developing a measure to really explore how each of these contribute to the overall sense of integration. So we have a really fun exercise where we go to a community where there is a Foundry Center, and we walk through with all the partners these various categories, and we have them self-assess where they stand. And it's an amazing way of really identifying what they need to do or what they want to do over the next year to improve the integration, improve the service delivery model by focusing on key areas of integration instead of integration as an overarching concept, really get into the weeds. And this has been something that's been very exciting for us to develop. Meaningful youth and family engagement is a tiered approach, and creating opportunities where they didn't exist is something that we've learned is necessary. I think Joanne mentioned, the need to have meaningful engagement. I know that this is something Access Open Minds does. And so we find that a lot of young people start in various engagement roles, whether it's a local advisory group or a provincial one, or even getting hired by the Foundry Central Office, where we have 5 young people working for us as engagement coordinators. Engagement is really an early place for young people to become involved with our organization. And then we've been able to find an opportunity to develop work and employment for them, not only if they're working for the Foundry Central Office in engagement, but also as peer support workers. And so this is a curriculum that was written by some peer support workers in our organization in partnership with Canadian Mental Health Association. And they've gone on to develop a practicum, and we now do semi-annual training of young people to provide peer support. I think that the importance of a backbone organization is one that we can't understate. The importance of backbone organization leading a responsive network is critical to the transformation. And so we have a team of 50 folks who work at Foundry Central office, and we have another team of 20 who work in virtual care. We try to effectively provide the functional backbone for our lead agencies, who are nonprofit organizations, in some of them very small. So we try to provide the functional support that they need to open up a center. This is we've understood over the years that this is a critical piece of our success. But what we also understood is the importance of working with the health ministry, the Ministry of Mental Health and Addiction, the Ministry of Children and Families, and really to share out the vision so that it's a shared British Columbia vision. It's one that's shared across the health authorities, shared across the ministries, the school districts, and our nonprofit organizations, to understand that if we're really going to be successful in what we do, we need everyone on board. And so the Ministry of Mental Health and Addictions and Ministry of Health and then Ministry of Children and Families have an implementation working group, and their sole focus, not their sole focus, but one of their key foci is to work on ensuring that Foundry is rolled out as per the strategic vision for the province. An example of how we've been able to pivot in a time of need was with our response to COVID, where we recognized overnight that young people weren't coming into centers, not because they weren't open, because for fear of contracting the virus. And so we were able to muster a response within 3 weeks by using our counselors in our existing centers to provide a provincial response to the needs of young people. And so we launched virtual care with 3 weeks notice. And what we were then able to do is partner with the province to identify the funding we needed to make this a more permanent structure. And as you can see, our numbers have been increasing week over week. The prioritization of partnerships with Indigenous communities needs to be owned by both the lead agencies and Foundry Central Office. And this is something that we have all recognized, is that early on, we left the building of partnerships to lead agencies to do locally. And we as a Foundry Central team didn't set out to develop a provincial or national approach to reconciliation and relationship building. And this is something that really has come about over the last couple of years, particularly in the last year, and work led by one of our directors. We now have several members of our team who self-identify as Indigenous working at Foundry Central Office and really focusing on shifting us into a two-eyed seeing organization. And this really requires us to be more humble and to understand that this is a long process. And as Seren Frisky wrote for us here, is that it's just like a Douglas fir. This doesn't happen overnight, and it takes time to evolve. And we have partners, Indigenous organizations that are willing to walk that journey with us, which is really exciting. Finally, a lesson learned for us is that the investment in integrated youth services is shifting our understanding of what it means to engage and support our youth and families. And I think that this is something that's starting to emerge out of our data. As we see here, young people are finding out about Foundry through friends and family members. It's not through the internet so much. It's not through websites. It's really through word of mouth, which is what we want if we're going to be successful. What also begins to emerge, just like Vidya had talked about, was the key piece around unmet need. And so what we're finding is that a lot of our young people will tell us that they would have gone nowhere if they hadn't come to Foundry for services. So what we are starting to break down is this idea of how do young people make choices and how can we impact each of those issues. So there's 10 really sort of identified elements to decision making. And so we're looking at these elements and trying to understand what we can do to shift young people through our doors or into our doors. And so these are all elements that we're starting to look at, and work done by Dr. Shelley Ben-David has been really interesting in understanding how Foundry sets itself apart from other resources. We also measure distress and distress levels, just like Vidya had shown us. And we notice here that there's an incredibly high level of distress in young people coming through our doors. 90% of our young people would qualify as either moderate or moderate high or very high in terms of distress levels. The very high level is even higher in virtual care, where it's close to 60% are have very high distress levels. But the question for us really is this an accurate measure, and what should we be measuring? Because as we've come to understand, young people have not really clearly defined what health means for them or what wellness means for them. And this is an area of interest for us, and that's work being led by Dr. Skye Barvik. And finally, we couldn't do this without our philanthropic partners, which there are many. But our plan has always been to match dollar for dollar our philanthropic partners with a government commitment. And so far we've been successful for that. And we continue to see our philanthropic partners grow. And I just wanted to take a moment to recognize who has helped us get to this point. So we'll just leave that there. And if there's any questions, or if anybody wants to reach out to me, please email me at this email address. Thanks, Elena.
Thank you, Steve. That's great. And there's so much there. And I know as well, so many results. Really appreciate you sharing those. I know that will be of a lot of interest to other jurisdictions. I also appreciate you highlighting, just the importance of thinking of communication strategy for different audiences, and really understanding the why people are accessing the services or not accessing the services. And great to see how Foundry is really filling a gap in the BC context of young people who wouldn't have otherwise accessed services. And also appreciate just speaking to the importance of the backbone. And I think the importance of the backbone and central coordination, all three of you could speak to. And so maybe I'll ask Joanna and Vidya to turn on their cameras, as well as Steve. Don't go away, because we're going to open this up for Q&A. And I think, for me, some of the common threads that I heard through all of your presentations were really just the importance of engaging youth and working with youth to develop out the services. The importance of adapting, and especially during the pandemic, how you've all been able to adapt and shift services and meet needs differently, including online. And then as well, just the importance of working with communities in the way they want to work with, and the balance of existing services with new investment to be able to really complement and build out the full suite of service offering that young people want. And really offering a variety of services that young people are needing. And I think both Steve and Vidya really spoke to how it's having a difference and the results they've seen, especially on the Kessler scale, and how we've been able to see improvement in young people. So I'm sure there's lots of questions. What I would encourage you to do is write in your questions. If you want to make a comment or share your experience, I see there's about 123 people online. And for those of you who weren't able to see where people were coming from, it looks like we have representation from across the country, except for 2 jurisdictions. So really diverse communities and diverse provinces. It looks like we have the most representation, about 28% coming from Ontario, followed by 13% of the people online are from Alberta, followed by Quebec, and then there's quite a few people from Saskatchewan and Manitoba as well. And so maybe I'll start the Q&A off as some questions start to come in, but I think, recognizing that in some of the smaller jurisdictions that are really starting to think about this work or moving forward, I'm just wondering if any of you could speak to some 1 or 2 lessons learned working in more rural and remote communities.
Alana, do you want?
Sure, go ahead.
I think all initiatives can speak to this, but the main points that I would make are the core principles and components still stay the same in terms of whether it's engagement of youth and community and stakeholder partners, in terms of ensuring that you're creating a service that's accessible, that's either based in primary care or in community settings. So those lessons remain the same. You do need, I think, even more so in rural and remote contexts than in urban contexts, community engagement and community ownership is extremely important. So in the urban context, often it was a little bit more organizational, and in the rural and remote context, communities took over and had a larger role to play. You may also need to think a little bit more creatively about resource constraints and lack of specialists if need be, and how to problem solve around that. So for instance, in two of the contexts that are in Nunavik and Northwest Territories, we really worked in building capacity in community workers who were the key face to the service, rather than trained people who would come on and off from cities. So you really do need to figure out what are your core principles and what are the resource strengths and constraints of the environment, and adapt the program to that. But I think it's doable. And what we're actually finding is that, in fact, it is in the remote and rural contexts that we find that for many people, this is the first service that they're accessing. So it is possible to do it. I don't know, Joanna and Steve, if you want to add anything.
Yeah, if I can add, thanks for that video. So, Alana, what I will say too is that this is the potential of a network. And so when you create a network, and this is something that I think is so difficult to fathom, but when you start to have 11 different communities pulling together, or 19 communities pulling together, you start to have a sense of, wait a minute, we're not alone anymore. You have these service providers who for years have been doing the best they can to provide, trans care, or to provide, care to severely mentally ill young people, and not really being able to tap into anything in terms of resources. And all of a sudden, they are part of a network where they can pick up the phone and talk to someone in a larger center, or they can ask if they can borrow a resource, or share a resource, or share learning. And that is an unbelievably powerful advancement in our field. It's something that I think in cancer has existed for a long time, but has not existed in this area. And that is something that I think as hopefully folks on this call today will think about. How can we create a network within our province or our jurisdictions to make sure that those smaller communities can focus on their strengths and then reach in to, or lean into the network to get their other needs met?
Thanks. That's great. So there's quite a few questions coming in, so I'll keep going. And there are a few questions about how you're ensuring consistent quality of services and adhering to the same principles. And I think, one of the questions specifically was especially, Steve, you talked about, and Joanna a bit too, as you engage more services and social services such as employment services, how are you ensuring a high quality and that they kind of stick to the same principles that you've seen throughout? So maybe that can be for Joanna or Steve.
So I think it's a critically important issue. We still have a fair amount of work to do to understand what are the key ingredients. And obviously Foundry has been doing a lot of work in that area. And I think Steve articulated some of that very nicely. But it really does require resources. So you need to be able to articulate what are the core components that you're aiming to have delivered. And they have to be not just kind of, we might think of that as being administered this questionnaire or delivered this treatment, but it also has to include the values, because so much of this is about the principles and the values and the way we approach the work. But being able to articulate what those core components are, to have a measure of each of those components, and then to implement that over time with consistency, and to have that backbone be equipped with the appropriate content expertise to work with sites to achieve fidelity, basically, on each of those core components. And if there are adaptations that are appropriate in the context of a particular site, then to be able to document those, learn from those, see how they're, perhaps adding to the potential outcomes, positive outcomes, and then being able to share it through that network, as Steve was saying.
And what I'll add, because I totally agree with what Joanna is saying, but I actually think that what we're trying to do a little bit here in British Columbia, and I think in Ontario as well, is change the way things are funded. And so we had an organization that just could not pull this off. They had been selected to open up a Foundry center. They couldn't pull it off. So we had to have some hard conversations and then move the contract. And I think that this is something that's very new in this space. But what we've been doing historically is project funding for 2 or 3 years, which doesn't allow for growth to happen, and it doesn't allow for the maturing of a service to occur in a community. And what I'm proposing, and what I think what we've managed to do in British Columbia, is get annualized funding to a concept and to a model, and then allowing within that have some strict standards that if they're not adhered to, you can have those tough conversations about. But with a 3-year cycle, you don't really have those conversations because the money's for all intents and purposes out the door. And then you're just re-upping after 3 years. And so I think most of us can concede that we need a strong investment for youth and youth mental health. So let's see that money committed long term, and then really have the standards in place that allow us as a network and as a Foundry Central office, or whomever leads this, the backbone organization, to really make sure that standards are being adhered to.
Great. So I'm conscious that the 3 of you have been at this work for a very long time, and specifically in your roles for several years now, but others who are participating on the line may be at different stages. And when you hear your presentation, it's kind of all come together so nicely. It makes it seem really easy, but I know that none of you would feel that it's been an easy journey. And so I'm curious, and there's a few questions about this, if you can share some of the early challenges you had, or maybe what surprised you in the early days, and offer any advice to kind of mitigate that for others who might be at an earlier stage in their development of this work.
I can go first. You're right. It is not easy. And I think it is about going into this work with an open mind. Really, we have to move away from an outdated model of expertise that has certain people having expertise who are going to tell other people how to do things. And although those are easy words to say, embedding that in a system that is really entrenched and wants to hold on to its old way of doing things is not an easy go. I think, how to ensure that you are inclusive of all of the voices, or as many of the voices as possible that need to be around the table, is challenging. And I think it's about every day sort of, it sounds really cliche, but it is about every day asking yourself, how well have we done? How and where are we not performing in the way that we want to? And what do we need to do to get there?
Elana, if I can add, I definitely agree with Joanna. Just sort of a couple of points. One, because we started as a project with many communities across Canada coming together in the project, we definitely started with projects with communities and sites that were at different stages of readiness. And that might, on the one hand, contribute to challenges, but I do also think that it has resulted in a lot more insights in being able to think about how is it that you, through the power of network, core practices, implementation supports, allow and enable and support different communities and all ships to rise in a way. Like so that's one sort of thing that I'd like to highlight. The second is when you are working across sectors, settings, provinces, each has different funding mechanisms in terms of services, in terms of record keeping, in terms of having a data system that can be implemented with fidelity. So that certainly is a challenge both in national projects, but also in provincial, because often there are systems already in place to do notes or to write. And it would be really valuable to start thinking about how can we have an integrated, health record and data evaluation and data fidelity system that's all integrated so that it can really be a truly learning health system. And then the last thing I would say is that, and because we started in the context of a research project, and yet we were really working in the area of service transformation, for some communities particularly, it's been, and so it's not an early challenge, but it's been an ongoing challenge, just this concern about making these massive transformations, increasing expectations in the community, and wanting to make sure that this is something that they can carry forward. And I mean, certainly there's a lot of progress that's been made in that front, but it is an important, that how do you think about transformations in a way, especially in small communities where expectations become really important for the entire community. Just sort of some additional pieces to add. And I think like also to make sure that even implementing small things often require navigating some logistical challenges. So for example, early on, the Youth Council and Access really wanted young people to be part of hiring decisions, which makes a lot of sense. If you want a youth-friendly service, you need youth to be part of hiring. But it did require navigating through union rules in many of the institutions. Like, how do you do that? And how do you still create this way of working where the youth voice is important? We were able to do it, but it seems it's a nice concrete example of how putting into operation some principles does require navigating through some ways that systems are set up. But it's doable.
Great. So there's another question here. Traditional systems of youth mental health care have relied heavily on psychiatry and hospital-related care. And I know that Steve and Vidya, you showed some early results, but I guess I'm wondering if you can speak to, and maybe we can start with Steve, to what extent you have integrated youth, to what extent integrated youth services or Foundry services have been able to provide effective alternative care in community to young people. And I think all three of you could speak. Let's start with Steve.
Yeah, I mean, I think there's so many ways that we've done that now. I think that, speaking on what we've done, we've managed to get, because it's a philanthropic partnership with government, there's an incredible amount of energy and excitement that goes into opening a Foundry. It just doesn't happen quietly in the community. And the staff at the hospital typically are very much aware. Sometimes the hospital foundation is actually leading the philanthropic charge. So there's certainly a knowledge and awareness. The other thing too is that we're getting young people way earlier than I think we have traditionally, because there is that alternative service that they much rather have. But I don't think that's enough. And so what we're starting to understand and do is to get working with the emergency room physicians in hospitals around the province. We've started this research looking at what their attitudes are and behaviors are with young people, and then having them have a dialogue with young people and their families to really understand what the other side is, because we really feel that part of what we have to do is actually transform what the emergency room experience is so that they are linked back in to services in the community and are aware that Foundry exists, whether it's virtually or in a center, so that the emergency room physicians feel like they too are part of this ongoing system of care, rather than just sort of a stop block and the reason why someone is or isn't coming into hospital.
Thanks. Joanna or Vidya, anything to add?
Elana, maybe just a quick point. I mean, I agree with a lot of things that Steve said. Just a few. One thing that we did really to support this was having a non-medical well-trained professional be the first portal of entry if you needed to do an assessment of needs. So we really insisted that it cannot be a psychiatrist, so that we, like, just for two reasons. One, because of availability blocks, and also we felt, maybe it's controversial, that it may not always be easy for a lot of them trained in that medical model to have this sort of slightly different, flexible, youth engaging, flexible way of meeting people and assessing their needs. And second, we also have many sites where already the services weren't very traditional in terms of the emphasis on psychiatry. So in smaller communities and indigenous contexts, this isn't the case. It's always been a lot more led by other professionals. And the third thing that I want to add is that while we can, for a large number of people, offer a range of interventions, like whether it's single session or solutions focused or peer support or virtual services, there is, and data is beginning to show that there is a group of people for whom the needs are complex, for whom we will need to think about continuity of care and ensuring that their needs are met too, not only in terms of psychiatric care, but because we know even for those complex conditions, psychiatric evaluation or management is just one small component. It's really having a plethora of high quality evidence-informed psychosocial services. And that is going to be something, I think, in the next wave of how we think about these services, we will need to do more to pay attention to.
Great. There's another question here, and somebody's wondering if you can speak a bit more to how you're working with schools and the connection with the education system. Joanna or Steve, do you want to speak to that?
Yeah, I mean, I can take a quick stab at it. Our Ministry of Education meets with us on a regular basis, and they have had their mental health strategy developed. Their approach has been more really encouraging school districts to choose from a menu of options when it comes to the interventions that they have and the prevention work that they do. So it's been a bit more challenging for us provincially to come in with a provincial strategy in terms of how Foundry works with the schools, because it's not the Ministry of Education really hasn't taken that approach in terms of having sort of a one strategy for all. That said, what we've done is really at the governance level for each of our centers, we have school district representatives or superintendents who are there. At the operational level, there are typically school counselors that are working with our centers, and so that they can streamline referral processes and even in some cases provide that solution-focused intervention themselves. We also see an opportunity. We do because of our partnership with BC Children's Hospital, we do the mental health literacy and promotion work in all the schools around the province, and it's branded Foundry for the high school kids. And we're really looking at some prevention models that we may be able to support around the province, and that's a key area for us. Eventually, what we would love to see is, as we have more and more centers around, in the different regions, that the school districts are really paired up to a center, and the streamlining will happen then. Finally, the province has been bringing in the model from New Brunswick, the integrated child and youth model, the TEAMS model. And we are actually working to develop a new sort of a new vision for what that can look like when you have Foundry as well as these integrated teams that typically are in schools. So we've been working with government to talk about what that looks like as they roll out and pilot 5 of these teams.
Great, thanks. And so maybe I'll take one last question, which is coming to us from the East Coast today. And so the question is, there's definitely momentum and movement happening across the country, and we're seeing more and more provincial approaches to this work. And really, this is becoming the next wave of youth mental health services. And so the question is, how do we collaborate and ensure that every youth in this country receive the same quality of care, regardless of where they live in this wonderful country? So thought I'd end on an easy question. And maybe you can take, as you answer this, if there's any last comments or thoughts you want to share for moving forward, now would be the time to do so.
Sure. I mean, I'll if I can go first, I would just say, it takes all of us to achieve that goal. So, Graham Beck Foundation hosting an event like this, bringing people together helps to build alignment across the country. Individuals, through our research projects, through our Health Canada initiatives, through various initiatives, working together to really benefit across our different initiatives, supporting new initiatives that are launching, organizations like Frame that also knit together not just the major provincial initiatives, but individual sites that might be just emerging in one locale. It really is about having some resources that allow us to connect as well. But I'll give everyone else, in terms of closing comments, it's so exciting to be back around this table, this shared table. Appreciate the opportunity and totally available if anyone wants more info.
Thanks, Joanna. Steve?
Yeah, what I will say is that, what we've heard today is that there have been pockets of initiation around this model in the country, and we've heard from various provinces. I know we've had conversations with various folks on this call that other provinces are really interested in getting this off the ground as well, and that it requires a certain level of investment early on, to catalyze this. And so what I think we want to really herald, and Joanna mentioned this in terms of Health Canada funding, part of the funding that Foundry has received, for instance, is to create knowledge products. And I know that, the Access Open Mind team and the Waihu team have also done that. And I think it's fair to say that our knowledge products are there. And so there's a lot of lessons learned. There's a lot of blood, sweat, and tears that has gone into those knowledge products. Most of us have been at this for somewhere between 4 and 6 years, and we've done as much as we can to capture that, so that fledgling initiatives don't have to kind of go through the same pain we went through, and also understanding that we are at a different time than we were when we started this out 7 years ago. And so how can we help you catch up? Reach out to us, and we're more than happy to share what we have, so that we can see this grow across Canada and really make this a Canadian response to the need of our young people.
Maybe Vidya, I'll turn it over to you for any last comments or thoughts that you want to share, and you're on mute right now.
Thank you, Alana. I think I'd sort of second all of what Joanna and Steve said. It's really exciting to be here. And I do agree that we are at a very different point from even 5 or 6 years ago in terms of being able to think a lot more about implementation across diverse contexts. Evidence is also coming in. There are multiple efforts where we are putting together initiatives across initiatives so we can learn together, whether it's the Work Employment Support Initiative that Joanna mentioned, or the Catalyst grant, which will be an additional opportunity to think about data collection. So there is a lot of value in really stitching together efforts and initiatives and learning from each other. So it's actually a very exciting time. It's also a very important time given the events of 2020 in terms of making sure that the conversation and some of these initial sort of things that we've put together are sustained and scaled up. Thanks, Elena.
Thank you. And thank you, Joanna, Steve, Vidya, for sharing several of your lessons learned. I know each of you could have presented all day if I had let you. So just really appreciate you taking the time to share some of what you've learned in your work so far and keeping it concise for everyone. I especially want to thank all the participants for taking the time, for asking questions, and for engaging in the content. I also would like to thank Cisco for allowing us to use the X platform to host this event. And I'd like to thank my colleagues, Allison and Gohar, for all the work they did to organize this event. Without them, we wouldn't be here today. I recognize there were lots of questions towards the end around virtual care that we didn't get to answer, but our hope is to put on some more of these webinars in 2021, especially given that we're not likely to be able to host our in-person policymakers workshop or webinar. So we will keep it in mind. I would also encourage you to fill out the evaluations that we'll send to you by email today so that we can get a better sense of what else you might want to learn. So thank you all very much, and I wish you all a lovely weekend. Bonne journée.